So good morning, guys. Lyle and Daniel. Hey, really a pleasure to be speaking with you both. This is the first MedTech20 of this year, so a big welcome to you both.
Thank you for having us.
Thanks, Gordon.
We have some pretty exciting and innovative technology to talk about today, but I thought a good starting point would be to give a quick introduction on CTI and perhaps a little bit of background on both of yourselves and maybe the roles within the business as well.
Sure, happy to do so. Yeah, Daniel Wachter. I joined CTI in July 2020 as a shareholder and chief commercial officer. I joined CTI with a background in flexible protective packaging. I've been working for a family-owned company for over 21 years. Have been in healthcare packaging. That's how we know each other with Bemis and MCore. And yeah, early 2020 got introduced to Lyle, who I found not only an intriguing person, but someone who has built a business based on chromatic technologies, which fascinated me. And he offered me to join the business to help to scale it globally. So that's what brought us together. It's 18 months into the job. I'm more excited today than I was July 1, not because of a lack of excitement at that time, but I understand the technology is better, the opportunities to scale the business, CPG, as well as in other applications in pharma. So yeah, appreciate the opportunity to talk to you again today.
Okay, I've had one job, and it's this job. Started the business back in 1993 out of college. Got an engineering background from Cornell. Had an attempt to play football there for a little while, and really got distracted, frankly, by lots of different things while I was an undergrad there. One of the things that I focused on was interactive microencapsulated technologies, thermochromic and photochromic technologies. Couldn't figure out why the world wasn't using these kinds of things on printed packaging, and started a business and did the traditional, I don't know if any startup is traditional, but I slept on the floor of a lab and I hauled a few pounds of ink down to New Jersey and New York on the weekends and to do press trials for a couple of years. Filed a patent on the first thermochromic offset ink for printing on checks, receipts, and coupons. That was back in 1994. It was issued in 96 when I moved the company out to Colorado Springs. Since then, we've kind of gotten away from protective security technologies. As you can imagine, checks, receipts, and coupons aren't nearly as big a deal as they used to be. So we've kind of moved into interactive packaging. So lots of food and beverage ideas. One of the ones that you probably have noticed, our most high-profile product is the Coors Light can. That was one of my pet projects. I invented the ink that goes on the Coors Light can. That was a multi-year task that ended up being our most successful technology. Really, I would say that is probably not the thing I'm most proud of. I think working with great teams and working with people that are smarter than me is something that I love to really be part of. I love the innovation process. I love the interaction, the interplay between capitalism, free markets, and innovation, and what it can do for human flourishing. Like, this is the miracle that's made modern society, freedom to make choices every day and see if you can make life a little bit better for yourself and the people around you. So that's what excites me. That's why I started the business. And I can say that I'm more excited about what I do today than I was the day that I started the business. The opportunities in pharma packaging, in indicators on food, and a chance to do something really meaningful in the world is something that just is really exciting to me. So that's me in a nutshell.
Wonderful. Thank you so much for sharing that. And in my humble opinion, I would consider Coors Light as part of the flourishing that you describe.
Yes, there's some 20-something men out there in the world who would agree with.
So Daniel, obviously you and I did this same podcast about a year and a half ago, shortly after you had made the move to Colorado to take on the CCO position. At that time you were talking to us a little bit about what you were doing or what you were thinking about doing in the med tech and pharma space. So it'd be great to hear, from you, Daniel, but also from you, Lyle, what are kind of the latest developments in this area for you guys since our last conversation?
Yeah, happy to give an update. Lyle and the team have further developed those chromatic technologies for various other applications that are not promotional like cores, but that are more of functional applications in terms of temperature. And these are applications in pharma, in medical device packaging, in HPP food processing, in roofing. So mid to long term, these are applications that we're focusing on to really prove the add value on what they can do. Obviously, this is the business development piece that is not yet sales, but really business development to prove the add value, to prove the right to win, and also to play to win on various fields. So that's what we're doing. And we're engaged in various projects at this time with pharma companies, with pharma and medical device packaging companies, in HPP food processing, to accomplish that mid to long-term business development piece. And obviously from an R&D perspective, we keep on pushing the needle. Lyle and the team, they are innovation driven. And we want to continue to provide great innovation to the world based on the existing technologies that we have, and further develop the business towards more functional applications. And again, thermochromic, like temperature indicators for temperature sensitive drugs, wetness indicators, humidity indicators for various applications where it is important to indicate a humidity, whatever those are. So that's still kind of the same balancing between short-term scalability of the business globally in CPG and mid to long-term the scalability into other applications in pharma, healthcare packaging, food processing, and so on.
So that's probably a good segue into some of the other work that you guys are doing together, Lyle, really on what you're doing in terms of developing this technology for cancer treatment. It sounds like it's kind of born out of a similar technology to CTI, but more focused specifically on the treatment of cancers.
Sure. It's a fairly audacious thing for a guy with ink under his fingernails to talk about doing cancer research. So I entered this conversation with a healthy dose of humility. However, we are where we are, as they say. There is, over the past several years, a real right to believe that we can participate in a cancer treatment solution. So goes back to 2009. We're a dye company in a lot of ways. So we use dyes to create the effects that we create. So I went out and found one of the best dye chemists that I could find in the world. The guy's name's Jim Krutak, worked for Kodak making photographic film, the dyes that would actually make the instant photography film appear when you take a picture. So really groundbreaking, fantastic researcher. He was at the end of his career, got interested in what we were doing. And on the first day that we were together, he showed me a picture. And if you don't mind, I'd like to share my screen for a second. So this picture that you see on the right was a picture that this gentleman showed me on his first day of work. This was a Friday afternoon, and he said, Lyle, we've been working on a dye that sticks to cancer cells in conjunction with Georgia State University, Emory University, and Harvard. The dye is this really exciting looking molecule that you see on the left-hand side there. It's a well-characterized dye. There's been a lot written about it. You can find it all over the internet. It binds selectively to cancer cells. There have been over 30 different cancer cell types that this dye has shown activity with. So it will stick to cancer cells. And this was a conversation that we were having at the end of the day. I thought, well, congratulations, Jim. well done. We're going to be focused on thermochromic materials. So good luck to you on your side project. Fascinating, but not really something that we're interested in.
Yeah.
2 days later, I was watching 60 Minutes on a Sunday evening, as I am wont to do, and I saw this particular show, right? This was the Cansius machine, is a story about a gentleman who had cancer, that guy that you see in the picture on the left there. He got the idea that he would use radio waves to heat up metal particles. So he would inject these metal particles into a hot dog and stick it into his radio wave machine, and it would just heat up the hot dog only where the iron particles were. And then he got the idea that he could use gold nanoparticles to heat up cancer cells using radio waves, right? So gold nanoparticles heat up in the presence of radio waves.
Okay.
So I am watching this show 48 hours after I've just seen my friend Jim, my VP of R&D, show me a dye that sticks to cancer cells. At the end of the show, they said the only thing that this technology lacks is a delivery system.
Right.
So I thought, well, I just saw a delivery system on Friday afternoon. What if we were to attach this dye to a gold nanoparticle?
Yeah.
And so you can see in this image here that we have a therapeutic agent. Let's say it's a gold nanoparticle, but it could actually be almost anything. And that's an important idea that we've only recently begun to explore. But let's say that you attach this to a gold nanoparticle, and this dye then binds selectively to tumors. You can see you administer these things into the bloodstream. This was the concept back in 2009. You administer it via an injection. These dyes travel throughout the body, just like in the mouse that you saw in the last picture.
Yep.
And this thing sticks to tumors in the body. You expose the patient to radio waves, and the gold heats up and shrinks the tumors. In 2017, we actually figured out, now I'm skipping ahead, you'll notice that we just went 8 years into the future.
Sure.
8 years later, we injected a gold nanoparticle that had this dye attached to it into the tail vein of two mice, the two mice that you see on the left-hand side of these two images. These are two identical images. One is a visible image, and the other one is a near infrared plus the visible image.
Yeah.
All three of these mice have tumors, colon cancer tumors that are grown on their flanks over a period of several days. We inject our product into the mice, and it would travel around the body of the mouse and only bind to the spots where the tumor was located.
Yeah.
So these are the first images we've ever generated of a near infrared dye, like the one you saw on the first slide there. Only these dyes have gold attached to them. So there is gold delivered to the tumor site in this image. Very exciting. I have had this on my home screen, this image on my home screen on my phone since 2017. I look at it every day because it inspires me.
Right.
This was a big deal. And we thought that we were pretty close, because the hardest part of this was supposed to be delivering the dye and the gold to the site.
Yeah.
The problem is we couldn't figure out how to get the gold to heat up. Well, there's lots of problems, but the biggest problem was getting the gold to heat up. We would put these things, just the straight gold, in a vial into a radio wave machine, and it wasn't heating up, right? Or it heating up, but then you take the gold out and the water would still heat. So it wasn't differentially heating.
Right.
The problem that we didn't know about was that in addition, so that's the first problem we knew about. The problem that we didn't know about was that this dye was accumulating in the liver at higher rates than in the tumor. So you see the image here.
Yeah.
We're seeing only the tumors light up. Well, it turns out that when you examine the liver and the kidneys outside of the body, we're noticing, the liver is actually taking up more of the product of this drug than the tumors are. That's
Right.
a showstopper, right?
Yeah.
You can't heat up and shrink the tumors while you destroy the liver. So this brought us, this was back in 2018 that we discovered this. And over the coming 2 years, our focus was to solve these two problems.
Yep.
Heating of nanoparticles on one side and preventing this dye from sticking to the liver. Those were the two main objectives over the last, for the last 3 years, 3.5 years.
Yeah.
This is a graph of what these dyes do. The standard dye that I just showed you. You can see that we have 5 different kinds of tissue: colon, kidney, and liver tissues in green, blue, and red, and then just normal tissues, normal healthy tissues for humans. And then that black one, A549, are the tumor cells. And you can see that the black line is buried behind the blue line in this graph.
Yeah.
The normal cells don't take up much of the dye, but everything else does. You know, this was the graph that gave us the biggest fits.
Yeah.
We've got a dye that's, yes, it binds to cancer cells. Yes, it generally avoids healthy cells, except for organs.
Right.
You know, problematic graph here, right?
Yeah.
I'm talking like I've done some of this work. I've done none of this work. We have a team of really impressive scientists, one of whom works for us. I hired another dye chemist in the intervening years who has designed these dyes to get them to bind to gold and subsequently to iron oxide. And he was trying to solve this liver problem for the last several years. And in late I think it was mid 2020, in the middle of the pandemic, he started reading some papers that demonstrated that we could make changes to the dye that would make it invisible to healthy tissues. A really exciting prospect, that because other people were looking at this dye just in isolation. People have not been looking at combining the dye and the gold nanoparticles.
Right.
But they have been evaluating this dye because it can be used to help a surgeon know where to cut.
Right.
But you want it to end up in the tumor, not in healthy tissues. So they've been looking for ways to help this dye bypass the kidney and the liver in particular.
Yeah.
But we have figured out how to generate heat using electric fields in the radio wavelengths and in magnetic fields. So electric fields will heat up gold, and magnetic fields will heat up iron oxide nanoparticles. And these nanoparticles, just to give you a sense of the size, if you were to put 3,000 or so, let's say between 2,000 and 4,000 of these things, depending on how big they are, they're so small that if you put them end to end, they would equal the width of one red blood cell.
Wow. Okay.
Yeah, so we're talking about really, really small. And that's why these things can actually penetrate the cell. They get inside of the mitochondria of the cell. The dye actually sticks to the mitochondria inside the cell, and it takes the iron or the gold with it. And we have demonstrated now anywhere from 10 to 20 degrees Celsius heating of these iron oxide or gold nanoparticles. So we've solved the heating problem, we think.
Yeah.
We've solved the accumulation problem, the quote unquote liver problem that was keeping me up at night. And as of a couple of months ago, so we're working with the University of Colorado Anschutz, their drug discovery lab. Dan LaBarbera and his colleagues have been testing our technologies on various cancer cells. They're the ones that generated the graph that you see here.
Yeah.
Ray designed 6 different dyes, all with different structures, that were supposed to give us an improved outcome. One of those, dye number 3, did this. Now, you remember the last one, right? Over the same period, we're measuring the fluorescence in the cells.
Yeah.
You can see now with this particular dye, there's almost no uptake of this dye in healthy tissues.
Yeah.
And significant uptake of this dye in cancer cells. This is a big deal.
Yes.
We did not generate this data, remember, right? This was generated by Anschutz Cancer Center.
Yeah.
Really, really exciting stuff. The other exciting thing is that because there's so many ways to design the dye, this works for lung cancer. This A549 that's a lung cancer cell line.
Yeah.
If we change the design of the dye, we can actually affect how it sticks to different kinds of cancer and continue to avoid healthy tissues. So, giant check mark for lung cancer.
Yeah, and obviously lung cancer is, one of the top of the list, unfortunately. So
right. And this dye will bind to over 30 different kinds of cancer. Right? We just need it to not bind to healthy tissues.
Yes. Yeah.
That's kind of the key.
Yeah.
We don't think this is meant to deliver the treatment, the therapeutic agent to the site.
Yeah.
And we focused on nanoparticles, iron and gold.
Yeah. 2
different heating mechanisms. But you can imagine that given the dangers of chemotherapy and the way that it's performed today, the biggest problem is that you only get 10 or 15% of a drug to the tumor site.
That's right. Yeah.
It means 85 to 90% is still destroying the healthy tissues.
Yeah. Yeah.
And if we could double the amount of chemotherapy drug that's delivered to the tumor site, just that would be groundbreaking.
Yeah. And
as you can see from this graph, we have a shot at doing much more than that.
Yeah.
So this is a potential application for not just nanoparticles and hyperthermia, meaning heating up the tumor.
Yeah.
You could use this with chemotherapy drugs, and it's actually one of the things that is so exciting to the folks at Anschutz. They have some really cutting edge drug technologies that they want to combine with this dye, a delivery system that could potentially enhance the efficacy of their current drugs.
So Gordon, to probably quickly summarize that, I think the progress that Lyle has presented in here brings us to the point that we have, first of all, a high level of confidence that we have solved one of the key challenges of the delivery system, to not stick to healthy cells, but really to tumor cells. So the effectiveness of the delivery, and based on what Lyle just said, we see two treatment options. The one combining the vehicle with nanoparticles, and on the other hand, to combine it with drugs to increase the effectiveness and not the spread of the drugs to healthy cells. So, and in that respect, we see ourselves now in a way that CTI has sponsored this project. Again, the common ground is dye. We use dyes for chromatic technologies that do what we do as a CTI business in promotional applications, in functional applications, but the dye are very important technology that help to really develop what Lyle just presented. And we think that with the solving of some of the challenges, with concluding the trial with mice in the next couple of months, we would like to change gears and to prepare for human trials in the next couple of years.
There is a very important point here at this stage that needs to be made. There is a controversy that has roiled ever since the Kansas program came out in 2009. Actually, I think the first time in 2008, and then they did follow-ups in 2009 and 2010. Labs all over the world have been chasing this little white rabbit called gold nanoparticle heating.
Right.
You can find articles written by very prestigious labs, some in California, some in New York, some in Europe, that will insist that either gold nanoparticles heat in electric fields or that they don't. Some that you can have two different labs that will come to completely different conclusions, which is a very interesting thing in research, right?
Yeah.
You'd think it'd be pretty easy to establish. It is not easy to establish this. It has been a very, very complicated thing for lots of reasons. And since Dr. Anatoly Pinchuk is not on with us now, difficult for me to articulate, other than to say the stuff that the gold is suspended in has an impact on the heating. And some people say, well, it's the stuff that heats, it's not the gold that heats.
Right, yeah.
So Anatoly Pinchuk has spent the last couple of years trying to answer this question.
Right.
He's been doing work with lasers, heating up gold, these gold conjugates that I just showed you, heating them up with near infrared lasers. He's recently published his work on that, but I asked him to answer the question about electric fields, because electric fields mean that you could stand in front of a machine and your whole body could be treated at once, right?
Yeah.
Lasers are very directed.
Yeah.
You could treat kind of like a non-surgical tumor removal.
Yes. Yeah. Yeah.
Lasers are directed. Electric fields you can have an electric field that will pass through your entire body, and that means whole body treatment of metastatic tumors. So tumors throughout the body. It wouldn't matter where it was. The dye would find it, and the radio waves would heat up those tumors. Yeah. So right after this slide that I just showed you.
Yeah.
So we've got this is gold, 3 different sizes, 5 nanometers, 20 nanometers, and 30 nanometers. And these are pictures that Dr. Pinchuk took of his lab. You can see that it's looks like a college benchtop, because that's what it is. You know, these are a couple of metal plates that you pass a current between, right? We put a sample between those 2 plates that has gold in it, and then we measure the temperature of the solution. You can see in this graph, regardless of the size of the nanoparticles, we are getting substantial heating in an electric field.
Right.
And we have discovered if you remove the gold from that same suspension and try to heat it again, you'll get some heating, but not nearly as much as you see here.
Yeah. Yeah.
This is a really big deal.
Sure.
You can see in this graph that you have a really fast heating rate at the beginning, and it levels off.
Yeah.
This happens with every one of these studies. And you would ask yourself, well, why is that? And the biggest reason is that at a certain point, the cuvette that has the stuff in it starts to throw off as much heat as you're adding to it.
Yeah. It's like
right?
a point, right?
Yeah, kind of like that.
Yeah.
If the vial is in room temperature and I keep putting in energy, at a certain point, it is tossing off as much energy as you are adding to it. And that's why it levels off.
Yeah, makes sense.
It's something that people often ask about, like, why is that? Why does it go to zero if I keep adding energy to it?
Yeah.
Well, it's because it's in a room that is 25 degrees Celsius.
Yeah. Yeah.
And by the way, another important point here is that tumor cells, it has been proven, begin to denature at about 6 degrees Celsius. Somewhere between 6 and 8 degrees Celsius. That's not that hot.
No.
Also, the human body can tolerate 3 degrees Celsius of heating without significant damage to healthy tissues, right? We've all had a fever of 103 and we didn't die.
Yeah.
Right? So if we have gold nanoparticles in portions of our body that are at substantially lower concentrations than that of the tumor, even in the liver, as long as we don't get to 3 degrees Celsius of heating anywhere else in the body, and at least 6 degrees heating within the tumor will stop growing. You're not going to cook it with 6 degrees, but the literature is clear that at about 6 degrees, these tumors stop dividing. That's the same as getting rid of the tumor.
Yeah. Yeah. Yeah.
As these cells will die off at a normal rate, and the tumor will shrink, and you don't have to worry about proliferation.
Yeah.
So these are substantial steps forward for the technology.
Yeah.
Hypothermia is so exciting because of its non-toxic nature. Gold has been proven to be non-toxic, and this is another really important point.
Of course.
That if we're adding, you can't inject something into somebody that's toxic, although that's what we do with chemotherapy drugs every day. Nowadays, you can't introduce a new drug that's toxic. So gold nanoparticles are inert. We have done toxicology studies on these, on the gold dye conjugates, and they are also non-toxic to healthy tissues.
Yeah.
And so we kind of got a check mark there, although every new conjugate or combination of drug or nanoparticle plus this tumor targeting dye, every one of those combinations have to be tested for toxicity. But what we've seen so far is very promising in terms of it doesn't hurt the patient. The presence of these themselves don't hurt the patient.
Yeah. And I guess, having not done human trials yet, do you have an idea of how long, and it's obviously dependent on the size of the tumor, I suppose, as well, but how long they need to be heated for and that kind of thing? Or is it?
I have no idea, Gordon.
Yeah, sure.
The answer is, this is so new.
Yeah.
Tuning the power and the frequency for a given situation, a given location in the body, the concentration of the product. These are all really important questions, and that's actually part of the next slide. So this is a kidney, I believe, with some gold nanoparticles in it, and the changes in the color are actually heating of those gold nanoparticles in the presence of radio waves. And this is a model of how the tumor would dissipate heat. Right? So the tumor gives off heat to surrounding tissues, and we have to be sure that those tissues don't get too hot. So there's a lot of modeling that goes on as part of this work.
with that being done, we think that we will be able to conclude the mice studies in the next couple of months. I think, Lyle, if I remember right, the goal is to have that done by end of fall, to then really prepare for human trials.
It sounds like you've done a huge portion of the research part, and now we need to start looking at how we take that to the next level.
Yeah. And I mean, I'm relatively new into that field. I have to admit, although when joining CTI, I was not only intrigued by the purpose of CTI as a business with what we do with promotional and functional applications, but ultimately with that bigger purpose that Lyle and a lot of smart people have started with the support of CTI from a financial perspective.
Is anybody else doing something that is comparable? I mean, obviously you have patents and IP protection, but are there competitors for you in a similar way at all or not?
So competition is an interesting question. There's a lot of folks out there doing nanoparticles, and there's a lot of folks out there doing the dye, right? Working on the dye. Yep. There's no one out there that we know of that's combining both of those, right, that is trying to attach the dye to a gold nanoparticle.
Yeah.
Really, they're trying to get the dye to behave more appropriately, and then they're trying to heat up gold with electric fields, mostly unsuccessfully.
Right. Yeah.
So they use for delivery systems for the nanoparticles things like antibodies.
Right.
So that's an additional approach for delivering something. It is a blunt instrument and has proven largely unsuccessful.
Yeah.
The real competition, the folks that take up quote unquote all the oxygen in the room, are things like immunotherapy.
Yeah.
That is our real competition, are the other cutting edge cancer technologies that have had some very impressive clinical results.
Yeah.
The issue with immunotherapy is the price tag.
Yeah.
Something between $800,000 and $1 million, as I understand.
Yeah.
What the Wall Street Journal says. There's also issues with changing your the approach for immunotherapy is really about changing the genetic makeup of your T cells. Right?
Yeah.
So I don't know what the risks are that come with that, but it feels like they aren't entirely. It isn't entirely without risk, let's say.
Yeah. Yeah. Yeah.
And so results don't pan out at all. So we're talking about 30 or 40% of folks that go through immunotherapy that don't have a healthy immune response and don't end up having the kind of results that others have achieved. So that's really the competition. Our solution, I think, would be more cost effective. It would also be more effective, right? You're using heat to destroy tumors. That's a very straightforward approach to treating a tumor, treating metastatic tumors. Obviously, these things are small enough to cross the blood-brain barrier, so you can treat otherwise untreatable cancers. So the promise is significant. The dye sticks to dozens of different cancer types, and those are the ones that have been tried. There's probably many others that it would bind to that have not been tested. So the question about competition is a real one. We don't spend a whole lot of time focused on it right now, but we do know what other people are doing in gold and with this dye, and the work is substantial, which kind of makes us feel like we're on the right pathway here. You know, there's a lot of people focused on nanoparticles and a lot of people focused on the dye. So we think that we have some reason to believe that this is a worthwhile approach. I guess if we're going to talk about the future a little bit, then Daniel alluded to this, but we've got a pretty detailed plan for the next 10 months that we want to execute. But we're going to be doing a lot of cell studies, right? Because nothing goes into a mouse until we can demonstrate that it's still safe, demonstrate that it actually has a chance of working. You know, we don't do those kind of studies lightly. We want to do everything that we can in a Petri dish before we move to live animals. But we think that if we can demonstrate that we can shrink a tumor in a mouse, right? I'm not saying we don't use the C word, no cure word used around this, but treat a mouse in a positive direction. We believe that we are in a position to really point ourselves toward human trials in the next 3 to 5 years. It's an exciting time, and I think that we have a clear pathway. The bench scale stuff seems to be promising, but push comes to shove when you put it in an animal and you see it actually behave. And sometimes the mice studies are misleading, I'm told, which kind of makes me a little depressed, but it's a fact. But larger and larger animals with a target toward treating people soon.
Wonderful.
Awesome. Great.
Thank you very much for this opportunity, Gon. Really highly appreciate it.
Really.
Most welcome. Always a pleasure, and really, really interesting to hear what you guys are up to. So thanks for sharing.